All right. Good afternoon, everyone. My name is Danae Aber. I'm the Executive Director of the Louisiana Rural Health Association. Thank you so much for joining us for this webinar titled Food is Medicine in Louisiana, a Landscape Review. LRHA is happy to host this webinar presented by the LSU AgCenter. This webinar is being recorded and it will be available along with a copy of the slides on the webinar recordings page of our website, and I will drop a link to that page into the chat. Your lines are muted automatically when you join, so please stay on mute throughout the session to prevent background noise. If you have any questions throughout, please go ahead and enter them into the Q&A box, and we will answer all questions at the end of the presentation. After you leave the webinar, a survey should automatically pop up in your internet browser. We do ask that you please complete that survey as it helps us to continue to improve our future events and identify future education topics that might be of value to our members. So with that, I would like to welcome Catherine Seals and Mackenzie Miller. Catherine Seals serves as the program evaluator for the Louisiana State University AgCenter CDC High Obesity Program. She collaborates with the parish extension agents to identify community needs, assess interventions, and measure program outcomes. Using data-driven approaches, Catherine analyzes and communicates the impact of HOP to government leadership, stakeholders, and Louisiana communities. Mackenzie Miller is a local food system specialist with the LSU AgCenter as part of the CDC High Obesity Program, SNAP Ed, and EFNEP teams. She works with extension agents and various players in the local food system to increase healthy food access in communities. So thank you so much to Catherine and Mackenzie for being here today, and I will hand it off to you.
Thank you, Danae. Like Danae mentioned, my name is Catherine Seals, and I'm the HOP program evaluator here at the LSU AgCenter. And today, myself and my colleague Mackenzie Miller will be talking about food as medicine and the landscape review that we recently conducted, as well as a produce prescription program that we just finished rolling out. So just quickly an overview, we'll do some introductions, we'll talk about the LSU AgCenter and our role in food as medicine work. We'll go over our landscape review as well as our produce prescription program. And then at the end, we will take questions if anybody has some. So as Danae introduced us, again, I am Catherine Seals. I'm a research coordinator with the LSU AgCenter, and I am also the program evaluator for our CDC High Obesity Program. And Mackenzie, do you want to introduce yourself?
Sure, thanks, Catherine. Hi, everyone. I'm Mackenzie Miller. I work with the LSU AgCenter, our CDC High Obesity Program, as well as the FNEP program. And I support our local agents in the field with their work related to healthy food access.
Thank you. And we also want to acknowledge our colleagues who I think may be on this call. Denise Holston, she is an associate professor at the LSU AgCenter in the School of Nutrition and Food Science, and she is the PI on our CDC High Obesity Program. And Jamila Freitman, who also works with us at the AgCenter and is our program manager. And then additionally, although they're not on this slide, April Temple is no longer on our team, but she just acknowledging the work that she did for our landscape review and our produce prescription program, as well as all of our local extension agents who really are instrumental in all of the work that we do. So just to start out, we wanted to kind of take a minute just to talk about the AgCenter and how we are involved in this type of work. So the LSU AgCenter is the outreach arm of the LSU system. We have offices in all 64 parishes with research stations in 15 of our parishes. And our mission is really to improve the lives of Louisiana residents through education and research-based information and interventions that really focus on grassroots issues and community needs. We have field associates in all of our parishes, and they really serve as the boots on the ground that deliver the education and disseminate, resources and services to the population. And it's through that network of extension agents that we are able to really be effective and efficient in our work that we do. And then within the LSU Ag Center, we have our Nutrition and Community Health Department. This was formerly called Family and Consumer Sciences, but a couple years back, we did a name change and rebranding to Nutrition and Community Health to really represent the work that we do. And we are focused on improving nutrition and public health, and we really use community-based approaches to implement policy, systems, and environmental changes and deliver robust nutrition education to Louisiana residents. And then lastly, we have our Healthy Communities Initiative, which is within the NCH department. And this focuses on creating healthier environments through community engagement and developing strong local partnerships to deliver these PSE changes and interventions. And I have up here a QR code in case you're interested in learning more about the different work that we do in NCH and in our nutrition education. That links to our website where we have lots of resources, research reports, all sorts of things, if you would like to learn more about all the different things that we do. And so you've heard me mention the CDC High Obesity program that we all work on. And this is a cooperative agreement that we have with the Centers for Disease Control. Through this cooperative agreement, we leverage cooperative extension services to increase access to healthier foods and provide more safe and accessible places for physical activity. This grant is specifically focused on parishes that have over 40% adult obesity rates. We are eligible for 35 parishes that are eligible for this program, and currently we are targeting 10, most of which are rural, aside from Terrebonne, which is kind of a mix of rural and more urban. We have had this funding since 2015, and we are currently funded through 2028. And with this grant, the state office, so me, Mackenzie, Jamila, and Denise, and other people at the state office, we really work collaboratively with our agents in our HOP parishes to deliver different interventions, different programs, and try to target our strategies to the residents of the communities. So what are our HOP strategies? So specifically focusing on food and nutrition, we work with local leaders to strengthen local food systems and improve health outcomes and drive economic development. We help partners set up food service and nutrition guidelines in settings such as schools, hospitals, food pantries, and other community institutions that serve, sell, or distribute food. We work to expand fruit and vegetable voucher incentive programs to support local farmers and make healthy food easier to access. So sometimes this might look like expanding the acceptance of SNAP Match or just SNAP in general at farmers markets or other retailers, as well as partnering with organizations like Grow the Good and things like that. We also enhance and expand produce prescription programs across the state. And we also work in ECEs to establish nutrition and physical activity policies. And lastly, we do host the Louisiana Charitable Food Summit every other year. And that really brings together all of the partners, local level up to state level partners that are involved in the charitable food system to learn and network and work collaboratively to improve charitable food access in Louisiana. So now I'm going to start talking about our landscape review that we conducted. The goal or objective that we set out with the landscape review was really to understand what food is medicine and nutrition incentive programs really look like in Louisiana currently. We felt like we needed to have a really comprehensive understanding of these programs, where they are in Louisiana and kind of what the gaps are before we could really engage in this work. And so we decided to conduct this landscape review. And we really just kind of needed to have a really deep understanding of who is involved in the work, and how can the LSU Ag Center be a part of this. And with this landscape review, we really wanted to be able to kind of document all of our findings, and disseminate it and inform stakeholders and people like you guys on the call, so that we could really try to move this work forward in Louisiana. So just a quick refresher on produce prescription programs. These are a way for healthcare workers to prescribe fruits and vegetables, usually with vouchers, for patients with chronic diseases and lack of access to nutritious foods. Prescriptions may be used in the healthcare setting or local farmers markets, brick and mortar or online grocery stores or mobile markets. And many of the produce prescription programs also offer nutrition education opportunities with them. So our methodology for the landscape review really focused on 4 parts: people, partners, community, and roles. So first, we wanted to identify who would be receiving these types of programs. So we identified our priority populations, such as low-income households, SNAP recipients, and individuals experiencing food insecurity. And then we also engaged with key partners across the state, like our charitable food organizations, nonprofits, food system partners, healthcare partners, to really gather insights and understand their experiences with nutrition incentives and produce prescription programs. We also conducted community asset mapping in all of our HOP parishes. And this was really a process of us cataloging and documenting the different assets that existed in each parish that played a part in health and food systems and physical activity in each community. And this helped us kind of identify where the gaps are and where the opportunities were within each community. And we also documented where food was sold, served, and distributed in each parish. And then lastly, we defined the potential role of the LSU Ag Center, healthy communities, and collaborative partners in supporting program uptake and expansion of food as medicine and nutrition incentives across Louisiana. And now I will turn it over to Mackenzie to discuss our findings.
Thanks, Catherine. As you may have noticed from the very long title, this landscape review, we looked at both fruit and vegetable voucher incentives, as well as produce prescription programs. And today I just wanted to focus on produce prescription programs and what the results were related to those programs from our landscape review. So through our conversations with partners, as well as our other activities in our landscape review, we identified key partner organizations implementing programs in Louisiana. So the first were charitable food organizations. Many charitable food organizations operate food as medicine or produce prescription programs. or have partnerships with healthcare entities to provide food to patients. Another key partner was organizations funded through USDA GUSNIP grant. And so many nonprofit organizations have been able to implement produce prescription programs through this funding. And we recognize that there may be other organizations engaging in this work in Louisiana, but these were a couple of key organizations that we identified in our review. And while there are various organizations engaging in this kind of work and these initiatives, overall, Louisiana lacks a robust food as medicine or produce prescription network that services communities across the state. So many of these programs are isolated to certain geographic areas in Louisiana. And existing efforts really highlight a growing interest as well as varied approaches to integrating food access and healthcare amongst a wide swath of organizations in Louisiana. Next slide, please. Through our conversations, we also learned that there are many barriers that exist to produce prescription program development and implementation in Louisiana, particularly in rural parishes. And some of these barriers include limited capacity of program partners. So this could be time, staff, or volunteers to be able to implement these programs, as well as things like space, maybe to be able to hold like a on-site food pantry or other materials needed to implement the program. Lack of consistent funding to be able to implement and sustain these programs was also a noted barrier. And especially for grant-funded programs, limited time frame to implement programs. So sometimes, you only have like 1 to 3 years to implement these programs, which can just be a challenge. And among program participants, limited to access to transportation can also be a challenge. And it just limits people's ability to be able to access the program or to be able to spend their vouchers, at local retailers. And in rural areas, lack of access to healthcare or limited food retail options can also be a barrier, as well as privacy concerns with participant data sharing or challenges connecting program participants with other services to be able to address additional needs that they may have. Next slide, please. So based on what we found through our review, we propose some recommendations to be able to implement and increase the uptake of produce prescription programs in Louisiana. The first, related to partnerships with local healthcare providers, is collaborating with local providers to build their capacity to participate in these programs, and as well as providing resources and support either to existing pantries that may be on site or to establish new pantries at healthcare providers' sites. And secondly, related to partnerships with the charitable food system, providing technical assistance to regional food banks to address any program barriers, expand their current efforts, and identify funding opportunities to sustain their programs. Also, collecting feedback from community members to ensure that the program design is reflective of the community that it's intended to serve. Also, connecting existing programs with sources of fresh, local, and culturally preferred foods. And lastly, leveraging relationships with local healthcare providers to identify potential program partners. Next slide. And some additional recommendations include educating cross-sector partners on current produce prescription initiatives, like we're doing right now. Standardizing program definitions so that we have a shared understanding of what, produce prescription or food as medicine means. And also coordinating with partners to expand these programs in Louisiana, as well as identifying best practices and creating resources and training opportunities to share with or to offer organizations across Louisiana. Related to support and sustainability of these programs, we recommend engaging with partners to bolster support for produce prescriptions in Louisiana, as well as exploring funding opportunities, especially through Medicaid and Medicare funding supports. There are a variety of funding mechanisms that can be used to support produce prescription programs. Some of these include Medicaid Section 1115 waivers, Medicaid managed care plans, and Medicare Advantage supplemental benefits. And Louisiana has used Section 1115 demonstrations and waiver authorities, but to my knowledge, not specifically for produce prescription programs. And lastly, to connect partners with LSU AgCenter programs and resources to further support these programs and program participants. Next slide, please. So now we'll talk a little bit about our experiences implementing the Healthy Families Produce Prescription Program in 5 parishes. So the Healthy Families Produce RX program is a USDA-funded pilot produce prescription program. It was originally developed and implemented by Share Strength in the North Shore and Acadiana regions in partnership with Aetna Better Health of Louisiana, Vouchers for Veggies, and the LSU AgCenter. The program concluded in 2024, but Share Strength received an extension to implement the program until January of this year. So Share Strength partnered with the LSU AgCenter CDC High Obesity program to expand the program into 5 additional parishes. So this included Assumption, Claiborne, Morehouse, Terrebonne, and Wynn parishes. Next slide, please. Some of the initial goals of the program were to improve child and household food security, improve dietary health and access to fresh fruits and vegetables, and to increase engagement with preventative health care. And to participate in the program, participants needed to have a child between 3 and 17 years old with Medicaid insurance and live or see a pediatrician in the participating parishes. So what did this look like for people participating in this program? First, eligible children and their families would receive a referral to the program from either their healthcare provider or a LSU AgCenter representative. And then the household will complete an online enrollment form to self-enroll. Then the LSU AgCenter team would review the information that they submitted through their enrollment form and confirm that they were eligible for the program. And then once they were formally enrolled, households would receive a Fresh Connect prepaid Visa card by mail, and the card would be loaded with $40 on the first of every month for 6 months. And these benefits could be redeemed at participating retailers, which included all Walmart and Albertsons locations, as well as a couple of farmers markets that we later onboarded. Next slide, please. So to implement this program, we first began by identifying and onboarding our healthcare partners. So our communications coordinator developed sample elevator pitches and program flyers for our team to use when we were approaching healthcare partners or potential program participants. And then to enroll in the program, either a healthcare partner could refer their patients to the program during a visit, or if a community member saw information about the program through social media or maybe through family and friends, they could contact the LSU AgCenter and we would refer them to the program. And those that were referred to the program used a Qualtrics survey to self-enroll. And then we would review the information submitted through Qualtrics and verify ability for the program. And then we would enroll them through a platform called Fresh Connect, and then they would be mailed that prepaid Visa card. And then once they were enrolled in the program, we continued to try and identify and onboard additional retail partners. So we were able to work with Fresh Connect to get 2 farmers markets in 2 of the participating parishes to be able to accept the benefits at their locations. And then we also provided ongoing support to participants. So if they had questions about the program, needed a new card, or had other concerns, we were available to be able to answer those questions. Next slide, please. So just wanted to highlight a couple of the communications materials that we use. So these were the flyers that we use to introduce the program to local healthcare providers, which is the one on the right. Just gives an explanation of the program and what referral would look like. And then on the left is our kind of general program flyer, and that could be used to refer people to the program. So it had a link as well as a QR code to that Qualtrics form where people could self-enroll in the program. And next, we will transition, and Catherine will share a little bit about the families that participated in the program.
Thanks, Mackenzie. So like Mackenzie said, I'll talk a little bit about some of the data that we have. So here we're looking at who actually participated in the program. We enrolled a total of 383 parents into the program, which translated to almost $92,000 distributed to families for fresh produce. And our approximate reach was about 1,425 residents that increased access to fresh produce through the Healthy Families program. And of our enrollees, 96% of them were female. And then on the right here, you see we have a breakdown of age and race. So most participants that enrolled were between 25 to 45 years old. And then we did have some younger parents that fell between 18 and 24, some more of the middle-aged group. And then we did have almost 4% that were over the age of 55. And then in terms of race, our largest group were Black parents, and then white parents. And then we also had some representation from Native Americans, the Asian population, people who identified as another race, and those that identified as more than one. Some characteristics of our participants. So the average number of kids per household was 2. And 66% of participants received SNAP when they enrolled, 23% received WIC, and 12% of participants had someone in the household that received Medicare. And also, not on this slide, we did measure food insecurity at enrollment, and 3 out of 4 of our households indicated that they were worried they would run out of food before they had money to purchase more. So we did have a pretty high rate of food insecurity amongst our participants. On this slide, you can see our parish reach. So Mackenzie talked about the 5 parishes that were targeted in this program. So that was Terrebonne, Assumption, Wynne, Claiborne, and Morehouse. But in addition to our target parishes, the program reached outside of those parish lines, and we actually had 11% of our participants lived outside of our target parishes. So that means that they had a child that was receiving health care within a target parish, but they, resided outside of that parish, which is fairly typical in rural settings. So this really highlights kind of the potential for these types of programs, specifically in the rural context, to reach outside the, parish lines of the places that you might be targeting, and also kind of demonstrates the just the vast reach that you can have in these types of programs to reach residents in Louisiana. We also conducted a post-evaluation survey. So during the final month of the program, participants received a text message notifying them that the program would be ending at the end of the month and that their card would no longer work after that. And in that text message, we asked participants to fill out a survey for us. We used the GusNIP pilot core metrics to design our survey. And we had over a 50% response rate. And of all of our survey responses, we had 194 total complete survey responses that we were able to use in our analysis. We are still in the process of analyzing this data. I actually finished cleaning it yesterday, but I did want to provide just some preliminary results just to kind of give you an idea of what participants thought about the program. So unsurprisingly, 98% of participants reported the program to be a positive experience, and 86% reported it as very, very positive. In terms of dietary impacts, we had 94% report that they increased their fruit intake, and 89% reported an increase in vegetable intake. 90% reported an increase in the variety of fresh fruits and vegetables that they were consuming, and 75% reported an increase in the quality of fresh fruits and vegetables. So 23% felt that the quality did not improve, and 2% actually reported a decrease in quality. And as you'll see on the next slide, we did have some participants gave feedback on kind of the limited options for being able to redeem their $40 only at Walmart and Albertsons. And so that may have contributed to the increase or lack thereof in quality if someone maybe didn't usually shop at a Walmart, Albertsons, and had kind of switch stores, that could have been contributing to that perceived lack of quality. And then lastly, we had 93% report an increase in their confidence to be able to eat fresh fruits and vegetables every day. We did collect data on other measures, so I just wanted to mention those here. We looked at child fruit and vegetable intake, barriers and facilitators to using the program, like transportation and access to the food retail outlets. We also look at food security and perceived impacts on physical and mental health. And we are working to, analyze that data and disseminate those findings through various publications in the future, which we hope to make available to everyone at some point in the future. We also, sorry, I didn't mean to do that. We also included some participant feedback that we got on our survey, so we did leave room for open-ended responses to our survey participants. So I just wanted to include some quotes here. There was tons of feedback to go through, but I will say for every quote that is on this page, there were probably 5 to 10 just like it. So I kind of tried to pull out some of the themes that I was seeing in the survey responses. But I really felt like these really kind of described the experience of the participants. So one person said, "I can afford fruits and vegetables. This program has helped me and my kids so much." And another one said, "While it helped tremendously, I rather buy fruits and vegetables from local stores than Walmart. Like I said, this was a common feedback that we got. Also, I was able to get many different fruits that I otherwise would not have purchased. Another person talked about how they were able to purchase more protein items due to saving on fruits and vegetables. And then also not having to worry about getting other things and being able to spend, food dollars on fruits and vegetables without having to worry about that. And lastly, we had one respondent who had said that they were diagnosed with diabetes the month before they started the program. So the program was really helpful to them in being able to eat more fruits and vegetables. And lastly, we just want to talk about some of the lessons learned that we had with this produce prescription program. Mackenzie mentioned that the program was a result of an extension of funding from Share Our Strength. And so the program was rolled out fairly quickly without a lot of lead time to prepare and all of that. But regardless, we had a very successful implementation of the program, but we still learned a lot of different things and lessons about doing these programs. And some of these include local relationships as being key to successful program implementation. I mentioned earlier on the call that we have local extension agents in each of our parishes, and their relationship building and the trust that they have in their communities was very instrumental in us being able to roll this program out and enroll participants on a tight timeline. And so having those relationships or partnering with organizations such as the AgCenter that have those relationships already built is definitely important to running a successful program. We also learned that establishing partnerships with local food retailers early on to reduce barriers to accepting these types of vouchers is important. Like Mackenzie said, we were able to enroll 2 farmers markets later on in the program, but there are some barriers, technology and logistics to having retailers be able to accept the Fresh Connect card or other types of produce prescriptions. And so kind of having those relationships developed and establishing those partnerships early can reduce some of those barriers and allow for more retailers to come on. Effective communications materials can also aid program implementation. We were, very grateful to have materials developed that were visually appealing and easy to disseminate. And then also using multiple communication channels to connect with participants. So this included things like social media and, sharing our materials with healthcare providers who were, a really crucial touch point to the audience that we were targeting, and kind of using a diverse network of communication to get this information out there so that we can enroll participants quickly. And the last thing that we learned is that there is a very high demand for produce prescription programs in Louisiana communities. I think at first we weren't really sure if we were going to be able to meet our enrollment target on the timeline that we had, and then that was quickly proven wrong, and we ended up having a much higher demand than we even had availability for, which was great. And we were able to, develop a wait list. And if we learned that someone who had enrolled wasn't eligible, we were able to take people off of the wait list. And still are receiving communication from participants, wondering if this program will be offered again. And so there really is a high demand and a high need for these programs. Lastly, before we get to questions, we did just want to take a moment to provide a link and a QR code to the landscape review that we went over earlier in the call. This is available online. It's on our website. And so if you scan the QR code or use that link, you'll be able to access it. We did publish this last year. So funding sources and partners and organizations that are involved are always changing. And so, they're just to keep in mind that this was published last year. And so there may be, new sources of funding available that aren't mentioned in the review, but nonetheless, this is available if you are interested in reading this or just kind of refreshing your memory on some of the things that we talked about. That's available to everyone. And now we would like to open it up if anybody has questions.
All right, thanks so much. We do have some questions in the Q&A box, so I'll start with those. But if other folks have questions as we're going through these, please pop them in there and we will get to as many as we can. So the first question we have from Kathy is, if an organization is already part of a Food is Medicine program, how can you enroll in the prescription voucher program?
I guess that would be like, could the organization get connected to the Healthy Families Produce RX program? I think I'll interpret it that way. Unfortunately, the program has ended with like the current funding that we had available. So it ended mid-January. So currently we're not, enrolling any new participants in the program. But we'd be happy to connect if you're doing Food is Medicine or produce prescription work as an organization.
All right. How did you measure food insecurity? What was the tool that was used?
I'll answer that one. So, like I said, we did use the GusNIP pilot core metrics. They had already kind of developed survey measures that they were piloting. So that's what we used on our survey. But it was 2 questions, and they're kind of the common food insecurity questions that are often asked. So one was, I was worried whether my food would run out before we got money to buy more. And the other one was, the food I bought didn't last and I didn't have money to get more. And then they would answer how often that was true. And that was asked both at enrollment and in the post survey.
Okay, thank you for that. Could a family purchase any other foods with the cards, and how did you track what was purchased?
The cards could only be used to purchase fresh fruits and vegetables. That could include things like pre-cut vegetables, or there are some things that it would include, but nothing with like added sugar or sodium or anything like that. And then sorry, could you tell me again the second question? How do we track what was purchased? We can't see the individual items that people purchased. We just know how much of the funds have been redeemed. But that would be nice to know.
All right, and the last one we have as of now, are these vouchers tax-free at the stores?
I'm not sure about that, actually. I'll have to ask. It's a new question.
All right, those are all the questions that we have in the Q&A box. While we just give another minute or two in case anybody's typing anything into the Q&A box, anything else you guys would like to share, Catherine or Mackenzie?
I'll just say again, we're continuing to explore opportunities to support Food is Medicine or produce prescription, as well as nutrition incentive programs in Louisiana. So we're more than happy to connect with anyone who, is currently implementing programs or, wants to learn more about the work that we've done. And again, a lot of the recommendations that we propose for our landscape review emphasize like coordination across the state and, you know, identifying best practices and things like that. So it's really valuable for us to all be able to share our knowledge and learn together as we explore these awesome new programs.
Are you looking at a specific geographic area for future partnership?
Well, our hop work, we do have our target parishes, but we have, you know, agents across the state. So just depending on what work people are doing, there may be opportunities for us to engage with one another.
All right. Just a comment here asking to share contact information. We'd love to connect as we're working on a food insecurity policy and implementation of a food prescription program. So I'm actually going to make, you should see on the screen now their contact information, but I will also make a note here of the person asking the question, and I will send a follow-up note to our presenters to make sure that they get your contact information. You can pop it in the chat if you'd like to just put your contact information in there and they should be able to reach out to you directly, but you should also see their email addresses there on the screen.
Yes, we'll add it to the chat. Thanks.
All right, seeing no other questions, we will go ahead and start wrapping up. Thank you so much, Catherine and Mackenzie, for your presentation, and thanks everyone for joining us. As a reminder, as you exit the webinar, you should automatically receive a survey. So please do take that. Again, that does help us to improve our future events and identify future education topics that would be of value. The recording of the webinar will be available on our website within the next couple of days. You'll receive a follow-up email about that. And as always, please feel free to reach out to us at the Louisiana Rural Health Association if we can be of any assistance. Thanks so much, everyone, and have a wonderful afternoon.
Thank you.
Thank you.